Injections is about a couple of things. BOTOX, different forms that help to soften lines and wrinkles, and filler, which is placing filler in areas that you've lost volume. As we age, our face looks like a triangle, and everything starts to go down and everything reabsorbs. And we really want to recreate the youthful triangle, which is an inverted triangle. And so building facial structure, and definitely with our weight loss patients who lose a lot of weight, trying to build up the cheekbones, build up the face, is definitely pretty awesome. It's pretty enjoyable to see, just from a little bit of fluid, how you can change somebody's contour and make them look more refreshed. Starting with people in their 20s and 30s with more dynamic expression lines, definitely can use BOTOX. And then honestly, 40s and above, we can all use that, as I know myself. The BOTOX is just for wrinkles, typically, to relax the muscles that cause the wrinkles. The procedure takes about 5 minutes. Really minimal downtime, and the effects start about 3 days out, and then it's finalized probably about 2 weeks. And it lasts about 3 to sometimes 4 months. It kind of depends on how active the individual is. If they exercise more, they kind of go through the neurotoxin a lot quicker than others. And then fillers, it depends on where you're placing the filler. I would say generally it takes about an hour or an hour and a half, depending on how much we're putting in. For the procedure, we do topical numbing. And so we wait for about a half an hour for that to get the best effect, and then I go and do the injections for the filler, and that takes about an hour or so. Fillers typically last on average about a year and a half. It depends on which type of filler you use, but generally about that long. One of the most fun parts of doing injectables is when I hand the patient a mirror and they look in the mirror for the first time and they're like, wow, this is me, this is amazing. And bringing them to that self, for me, is so rewarding.